Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is 3klpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with a series of lectures of Prime Neurology. There are going to be about 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on part 34, Prime Neurology, Muscle Disease and Overview. So in this episode we are going to discuss muscle disease and overview. Muscle disease. Introduction. Muscle diseases or myopathies may be intermittent or persistent and usually present with proximal symmetric weakness with preserved reflexes and sensation. Any associated sensory loss suggests injury to peripheral nerve or the central nervous system rather than myopathy. Any disorder causing muscle weakness may be accompanied by fatigue, referring to an inability to maintain or sustain a force. Muscle disorders are usually painless. However, myalgias or muscle pains may occur. Myalgias may be distinguished from muscle cramps, that is, painful involuntary muscle contractions usually due to neurogenic disorders. A muscle contracture due to an inability to relax after an active muscle contraction is associated with energy failure in glycolytic disorders. Myotonia. Myotonia is a condition of prolonged muscle contraction followed by slow muscle relaxation. Creatine kinase is the preferred muscle enzyme to measure in the evaluation of suspected myopathies. Electrodiagnostic studies, that is nerve conduction studies and electromyography, NCS and EMG are usually necessary to distinguish myopathies from neuropathies and neuromuscular junction disorders. Inflammatory myopathies. The most common group of acquired and potentially treatable skeletal muscle disorders. 5 major forms are present in inflammatory myopathies. 1. Dermatomyositis. 2. Inclusion body myositis. 3. Polymyositis. 4. Immune-mediated necrotizing myopathy. 5. Antisynthetase syndrome. They usually present as progressive and symmetric muscle weakness. Extraocular muscles are spared, but pharyngeal weakness, dysphagia, and head drop from neck muscle weakness are common. Respiratory muscles may be affected in advanced cases. Inclusion body myositis is characterized by early involvement of quadriceps, which leads to falls, and distal muscles. Inclusion body myositis may have an asymmetric pattern. Progression is over weeks or months in PM and dermatomyositis, but typically over years in IBM. Skin involvement in dermatomyositis may consist of a heliotrope rash, blue-purple discoloration of the upper eyelid with edema, a flat red rash on the face and upper trunk, or erythema or knuckles known as Gottron sign. A variety of cancers are associated with dermatomyositis. Treatment of inflammatory myopathies. Often effective for all disorders except for inclusion body myositis. Step 1, Step 2, Step 3, Step 4. Step 1, we give glucocorticoids, that is prednisolone 0.75 to 1 mg per kg per day for 3 to 4 weeks, then tapered very gradually. Step 2, approximately 75% of patients require additional therapy with other immunosuppressive drugs, that is azathioprine up to 3 mg per kg per day, methotrexate 7.5 mg per kg per day, gradually increasing to 25 mg per week, or mycophenolate mofetil up to 2.5 to 3 grams per day in 2 divided doses commonly used. Step 3, IV immunoglobulin 2 grams per kg divided over 2 to 5 days. Step 4, rituximab 750 milligrams per square meter up to 1 gram IV with a second infusion 2 weeks later, and repeat courses every 6 to 8 months as needed. Now we'll discuss disorders of muscle energy metabolism. The two principal sources of energy for skeletal muscles are 1. Fatty acids, 2. Glucose. Abnormalities in either glucose or lipid utilization can be associated with distinct clinical presentations that can range from an acute painful syndrome with rhabdomyolysis and myoglobinuria to a chronic progressive muscle weakness simulating muscular dystrophy. Diagnosis usually requires biochemical enzymatic studies of biopsied muscle. Mitochondrial myopathies. These result from defects in mitochondrial DNA. Clinical presentations vary greatly. Muscle symptoms may include weakness, ophthalmoparesis, pain, stiffness, or they may even be absent. Age of onset ranges from infancy or to adulthood. Associated clinical presentations include ataxia, encephalopathy, seizures, stroke-like episodes, and recurrent vomiting. There are three groups: CPEO, skeletal muscle central nervous system syndromes, and pure myopathy syndrome stimulating muscular dystrophy. The characteristic finding on muscle biopsy is ragged red fibers. The characteristic finding on muscle biopsy is ragged red fibers, which are muscle fibers with accumulations of abnormal mitochondria. Affected families often have a maternal pattern of inheritance, that is, it comes from mother. Affected families often have a maternal pattern of inheritance because mitochondrial genes are inherited almost exclusively from the oocyte. Periodic paralysis. Muscle membrane excitability is affected in a group of disorders referred to as channelopathies. Onset is usually in childhood or adolescence. Episodes typically occur after rest or sleep, often following earlier exercise. May be due to genetic disorders of calcium, example hypokalemic periodic paralysis, or sodium hyperkalemic periodic paralysis, chloride or potassium channels. Attacks of hypokalemic periodic paralysis are treated with potassium chloride, usually oral. Prophylaxis with acetazolamide 125 to 1000 milligrams per day in divided doses or dichlorphenamide is usually effective in hypokalemic periodic paralysis type 1. Attacks of thyrotoxic periodic paralysis resemble those of hypokalemic periodic paralysis. Attacks abate with treatment of underlying thyroid condition. Now let's talk about endocrine and metabolic myopathies. Abnormalities of thyroid function can cause a wide array of muscle disorders. Hypothyroidism is associated with muscle cramps, pain and stiffness, and proximal muscle weakness occurs in 1/3 of patients. This relaxation phase of muscle stretch reflexes is prolonged and serum CK is often elevated up to 10 times normal. Hyperthyroidism also can produce proximal muscle weakness and atrophy. Bulbar, respiratory and even esophageal muscles are occasionally involved, causing dysphagia, dysphonia and aspiration. Other neuromuscular disorders associated with hyperthyroidism include hypokalemic periodic paralysis, myasthenia gravis, and a progressive ocular myopathy associated with proptosis, Graves' ophthalmopathy. Drug-induced myopathies. Now let's talk about drug-induced myopathies. Drugs including glucocorticoids and lipid-lowering agents, that is statins, and toxins, example alcohol, are associated with myopathies. In most cases, weakness is symmetric and involve proximal limb girdle muscles. Myalgia and cramps may also occur. An elevated CK is often found. Diagnosis often depends on resolutions of signs and symptoms with removal of offending agent. So these are the wonderful concepts of muscle disorders and overview. The other important concepts of clinical neurology, I put it in a book called Exam Oriented Clinical Neurology, written by me, Dr.Sreenivas. This book will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other book I wrote is Focus Neurology. It contains all the essential elements of theoretical neurology. This book is written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. This book will be very useful for students appearing for oral exams. This book is available online from all leading booksellers including Amazon, and if interested, this book could be purchased online. As I said earlier, there are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Just now we are done with another episode of Prime Neurology. If you have liked this, please like, share and subscribe to my YouTube channel Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.